Good afternoon, everyone. Welcome to the webinar. I'm Lisa Washburn, Associate Professor and Community Health Specialist with the University of Tennessee Extension, and this is the second in a series of monthly webinars addressing opioid misuse in Tennessee. This series, Using Data for Action, What You Need to Know, is brought to you through a partnership between University of Tennessee Extension and East Tennessee State University's Addiction Science Center. This effort is part of a USDA-funded project preventing opioid misuse through partnerships and training in Tennessee, or PROMPT-10 for short. I'm pleased to introduce Angela Hageman, Director of Operations at the ETSU Addiction Science Center. Today, Angela will help us to unpack Tennessee adolescent substance misuse data. Thanks, Angela, for being with us.
Good afternoon, everyone, and thank you, Lisa. Happy to be here and very excited about this project and opportunity to talk with all of you and share some data and answer any questions that you might have. So as Lisa suggested, today we'll be talking about specifically adolescent substance misuse data. Last time we talked about opioids in general and the problem of opioid misuse in both the United States and Tennessee. So today, these are our learning objectives, and understanding that in about 20 minutes or so, we'll only be touching sort of the tip of the iceberg of some of the data. I'm going to arm you with some resources that you can dig into later and better understand the prevalence of substance misuse in Tennessee and in the United States. We're going to talk a bit about risk and protective factors for substance misuse. While we're focusing on data, we will spend most of our time talking about and understanding risk in certain subpopulations and with certain substances. We will talk a bit about protective factors today and begin to dive into that a little bit more during our next module. You're going to leave here with some resources so you'll know where to find data for your community and identify ways that you're already making a difference in your community and ways that we can continue to fine-tune that and do more of that. So it's always good to start with sort of our commonly used terms. I know we hear about opioids in the media and in the news, and we hear about them in our work, but it's good to understand what is an opioid. And so we know that there are both natural, synthetic, meaning man-made, and semi-synthetic chemicals that work on the opioid receptors in our brain and reduce the intensity of pain signals and the feelings of pain. Opioid analgesics, or opioid pain medications, are prescribed to treat pain, and there are natural opioids such as morphine and codeine, semi-synthetic opioid analgesics, oxycodone, hydrocodone, methadone, and tramadol and fentanyl. So those are some of the names of some of the prescribed opioids that we hear about. Now, illicit drug use can be not just illegal drugs, but also these legally prescribed drugs are illicit when they're misused or used in a non-medical way. And we hear about overdose. We often think that this is a fatal injury, but an overdose can be fatal or non-fatal. It is poisoning that happens when a drug is taken in excessive amounts, and it's different symptomology for different drugs. It's also important to understand the difference between tolerance, dependence, and addiction. And so tolerance occurs when someone begins to experience a reduced response to medications or opioids and needs more of that to have the same effect that they previously did. Dependence is when the body begins to adjust normal functioning around regular opioid use, and unpleasant physical symptoms, sometimes called withdrawal, can occur when someone is becoming dependent on medication. But this does not mean that they have opioid use disorder necessarily or that they're addicted. So there are opportunities to intervene prior to opioid use disorder. The full onset of opioid use disorder usually occurs over a 12-month period or is diagnosed after a 12-month period when multiple attempts to cut down are unsuccessful and problems and a failure to fulfill obligations at work, school, and home. And this dependence, this withdrawal and symptoms of physical symptoms make it more difficult to stop use. So in order to understand Tennessee data, we do have to understand a little bit more about what the national trends for youth risk are. So the Youth Risk Behavior Survey is a survey that's given across the United States every other year, and it has data from the past 10 years. So we can really look at trends in 4 categories: sexual behavior, high-risk substance use, experiencing violence, mental health, and suicide. And I will say that, as I forgot to say this earlier, any questions that you have along the way, please post those in chat. Dr. Stephanie Mathis from my team will be helping to monitor that and has helped me put together this slide set. And every slide should have a data link at the bottom that you will have access to. So if you have any questions later, or want to dig in a little deeper, those links will be available to you. So as we look at the Youth Risk Behavior Survey findings from 2019, we do see some positive trends, particularly in areas of sexual behavior and high-risk substance use. So one example is that students who were surveyed in 2019 reported a lower prevalence of use of illicit substances from between 2009 and 2019. You can see that that decreased by 5 percentage points. So it's good to see that in many categories, we are moving in a positive direction. Specific to prescription opioids, which is in many ways what we're here to talk about and understand more about, the box on the left shows students who reported ever having misused a prescription opioid. And so we see there that about 14% of the students surveyed reported that they had misused prescription medications. And we see that that's segregated by gender and race and ethnicity, showing that in some respects, females were more likely to report misuse during this survey, and Hispanic and Black populations more so than white populations. Over on the right is a brand new question this year, and asked students, in the past 30 days, have you misused a prescription medication? And during this survey, about 7% did report using in the past 30 days. And again, you see the breakdown by gender, race, and ethnicity. So it's important to understand, why would we talk about substances and behaviors separate from opioids if this topic is around opioids? And we see here with data from the CDC that not only do we see percentages of students reporting, and I will say that the Youth Risk Behavior Survey is given to high school students in the United States. So that particular data is specific to high school students. So they're reporting misuse of prescription opioids, but if you look down, you see that youth opioid use is directly linked to sexual risk behaviors, physical and sexual dating violence, and mental health and suicide risk. So it's important that we understand all of the other factors that are involved for risk for our young people. So as we look more about the 2019 national findings, all right, so the Youth Risk Behavior Survey uses green buttons for trends that are moving in a positive direction, red buttons for data that are increasing and moving in a more negative direction, and then the yellow buttons are issues that are staying steady, so still need attention, and we understand that there's still reason to be creating more safe environments for youth. So we see here that fewer students over this 10-year period reported being threatened or injured with a weapon at school, and fewer experienced physical dating violence and sexual dating violence. And so even though we're moving in a positive, we're seeing positive trends in this national data, that never means that we should stop focusing on these areas. We always need to be continuing to do the good work that we're doing to reduce this risk. But in other areas, we need to pay attention when things are getting of more concern. So many more students reported in 2019 as compared to 2009 that they were not going to school because of safety concerns. They were also continuing to experience problems with being bullied, both at school and electronically, and also more were reporting that they were forced to have sex. So that trend is not improving as much as we would like to see it. And again, those links are always available to you if you want more information about these particular data points. So we're looking now at the category of mental health and suicide. And unfortunately, we're seeing more negative trends in this area than we've seen before. And keeping in mind, this data is from 2019. And so there is not a survey in 2020, but one might imagine that during this time of a pandemic, that these trends may look very different during the 2021 administration. So we're seeing that many high school students in the United States are experiencing persistent feelings of sadness and hopelessness, seriously considering suicide, and some actually making a suicide plan or attempting suicide. So it's important to know these risks and to learn more about what we can do in communities. Also, during the 2019 administration, we're seeing higher risk in many categories for sexual minority youth. While the percentage of LGB youth who experience physical dating violence is in a positive trend and is decreasing, we see that many more are being threatened at school or threatened with a weapon or injured with a weapon and did not go to school because of these safety concerns. And they are also seriously more than other populations considering suicide, and even fewer than in the past administrations are accessing HIV tests. This is a national trend that young people are not getting tested for HIV at the same rate that they were in earlier years, but even more so for this population. So it's important to know sort of our subpopulations of students who are experiencing increased risk. So as we understand that and get sort of that brief beginning overview of what we're seeing at the national level, Tennessee Department of Mental Health and Substance Abuse Services provided a survey of Tennessee students in 8th, 10th, and 12th grade. We see that 21,000 students were surveyed in 2018 and 2019. And this slide shows you sort of the representation across the region. So you may see your county here and know what region you fall into. Now you'll see that some regions had lower numbers than other regions, but there's some mathematical science that's going on behind the scenes that weights these so that each region is equally represented in the survey. And this is a good representative survey of what students are experiencing in the state of Tennessee. And as always, again, these are linked in the bottom so you can look at the full survey. When we look at comparing Tennessee previous data to national averages, we see that in many respects, Tennessee is lower than the national average, meaning that fewer students are reporting misuse than the national average. Fewer students in Tennessee are reporting misuse of certain substances than the national average. So if we look at pain reliever misuse and students that reported pain reliever misuse in the previous year to surveys, in 2011 and 12, 6.6% of our students reported misusing substances, and that was above the national average. And in the most recent data of 2016 and 2017, we see that we've lowered that risk or lowered the prevalence of misuse of pain medications. Now, again, that doesn't mean that we are going to ignore that. We're going to continue working to increase that positive trend. We see that in alcohol use in the past month, binge alcohol use in the past month, that we are lower than the national average. Unfortunately, in Tennessee, in regards to tobacco use in the past month, we are seeing a higher prevalence than the national average. So again, those are data that are important to note, areas that may need increased attention and focus. And we'll talk a little bit more about protective factors this time, and in future modules, what can we do about these data. And so again, marijuana use in the past year and past month are lower than the national average. So we're going to dig into the 4 categories of drug misuse in the Tennessee Together survey. And so related to prescription drugs, we see that about 1 in 10 students, and these are again 8th, 10th, and 12th graders, 1 in 10 reported that they at some point in their lifetime misused a prescription drug. The average age of onset or initiation of this misuse is about 13 years old. And it looks like about half, you can see in the left box, about half of students reported that it was either very easy or fairly easy to obtain these drugs that were not prescribed to them. So again, an important thing for us to note that access to pain medications that are not prescribed to them are something that we may need to focus on. Now, the right-hand box is past 30-day use. So of students who were surveyed, 3.7% reported that they did misuse pain medications in the previous 30 days to the survey. And of those, about 22% reported that they used them on more than 6 times in those 30 days. So that's high frequency use. Again, a subpopulation that we may need to focus on. You can see that the trends vary across regions. So in this particular data set, region 6 had a higher prevalence than other regions. And so again, these data are important as we focus our efforts to understand what's happening across our different regions. They did report also that 12% of them reported that at least one of their closest friends was misusing prescription drugs. And so that's, again, important to note. And that about 36% said their parents had spoken to them in the past year about the dangers of misusing pain medications. And what we know as a protective factor is that parent communication is incredibly important to reducing risks. And we think that teens maybe aren't listening to us, but studies are showing that they really do listen to their parents. So any way that we can work together to increase parents' confidence and competence in having this communication on a regular basis is very important. So when we look at the data for marijuana misuse, 1 in 5 students in Tennessee reported ever using marijuana in their lifetime. The average onset again is about 14 years old, and over half said that it was easy, very easy, or fairly easy to obtain this substance. Past 30-day use was about 11% of those surveyed had used it in the past 30 days, and half of those reported that they were using it at least 6 days per month. You can again see the prevalence across the different regions of our state, and that 33%, which is more than prescription pain relievers, peers reported that their friends had used it in the past year. Parent communication in this particular data set shows that students were asked if their parents spoke to them about alcohol, tobacco, and other drugs, and about half of the parents had, which is great news. And this same parent communication will be similar across all of the next few slides. So alcohol is the most misused substance in the state of Tennessee by these students in 8th, 10th, and 12th grade. 4 in 10 reported ever having drank alcohol, and the average age of initiation, again, is 13 years old. So as we begin to think, if young people are beginning to misuse these substances around the age of 13 or 14, what work can we do? What protective factors can we put in place to prevent that first misuse? And again, students reported that it was very easy or fairly easy. 62% nearly reported that it was easy to obtain alcohol. So again, thinking through how we can reduce that access. On the right, we see that 17% misused alcohol in the past 30 days, and 22% of that 17% reported high frequency use. 45% reported that their students or that their friends had had one or more drinks of an alcoholic beverage. And again, about half of parents are communicating about alcohol as well. And again, we're looking at tobacco, and while it is not the most misused substance, alcohol is among young people, it falls in a very close second. And so 1 in 3 students reported ever smoking cigarettes, e-cigarettes, or smokeless tobacco during their lifetime. And this data is segregated by cigarettes and e-cigarettes. And so we see that the average age of initiation for e-cigarettes is a little bit higher than for cigarettes. And students reported that it was quite easy to obtain these products. And then on the right, we see that in the past 30 days, more than twice as many students had reported using e-cigarettes as compared to regular cigarettes. And many were using at a high frequency, more than 6 days a month, and more reported that their friends were using e-cigarettes than cigarettes. So again, very important to know these data and understand these data and encourage parents to continue having these conversations. So it's difficult to access specific drug overdose death rates for young people. The closest that we can get to the data is understanding that in the age category of 15 to 24 years, we see that the number of folks, young people dying from drug overdose in Tennessee continues to increase over this 3-year period. And that follows the trends for adults as well. So we're not, unfortunately, seeing a decline in drug overdose deaths in Tennessee for adults or young people. So all of this feels very complex, and we wonder, what can we do? And so that's why we're here talking today, is to understand the data, to continue to dive into that more deeply, and to better understand what protective factors can be put into place in our communities. So this slide sort of is a good introduction to what is a protective factor and what are risk factors, and how do we sort of understand risk, like we see in the left-hand column, and that's the data we've been talking about. So we're knowing a little bit more about alcohol being the most frequently used substance, and how easy alcohol and tobacco and other drugs are to obtain for young people. And we talk about protective factors. We're learning that in long-term studies, adults who had strong connections to adults, positive peers, their school, and their community were almost half as less likely to have mental health issues, experience violence, engage in risky sexual behavior, and use substances. So knowing more about what are these protective factors, and some of them are schools implementing positive youth development programs. And I know many of you out there are working with young people, and the work that you're doing is building protective factors that reduce risk. And we know that parent communication is also a strong tool to reduce risk for young people. And providers and the community increasing school relationships so that young people feel safe and bonded to their communities. All of these things make a big difference in reducing risk for our young people. And again, we'll be talking more about that in future, in our next webinar. And so here are the data resources that are available to you. And I know that Dr. Mathis is going to be putting these in chat, so you'll have quick access to them and you can begin clicking through and learning more about this if you're interested. And these slides are going to be available to you. This recording will be available to you on the Prompt TN website. And we're always here to answer any questions that you have related to these data pieces. And so again, I know that there might be many questions posted in chat. And again, during this short time that we have together, it's just an overview of what we're seeing in the data, and hoping that this will begin to open conversation and allow us to work together to make our state and our nation, more safe for our young people. Our next module will be on March 24th at 1 p.m. Eastern, 12 p.m. Central. All right, thank you.
That was a lot of information, and I was not aware of the differences between the different areas of the state. I was a little surprised by West Tennessee's percent being higher on some indicators than other areas.
Yes, we were too, because we've often, sort of been looking at data, especially for adults, and East Tennessee does seem to be sort of a hot spot for misuse. And we've sort of assumed that East Tennessee was having higher prevalence than other regions, but that was interesting for us as well.
Well, Angela, I want to touch back on something that you said toward the end, because you were talking about positive youth development. And I think that oftentimes when we consider how we can prevent adolescent substance misuse, we think purely in terms of the substance and telling them to avoid substances. But really, a lot of the things that we do to help them develop strong relationships and other things, those play as much or if more of a role in protecting them from engaging in risky behaviors.
Yes, yeah, I think in the past we thought sort of DARE and other programs that sort of talked specifically about substances were the only way to go. And we've learned so much over the years that really making students feel safe and bonded to their peers and having healthy communities and limiting access, without not just talking about it, which is very important, but making sure that we're securing alcohol in our homes and that we're training our retailers to adequately check IDs, and that we're making sure that our prescription drugs are locked up, because we're seeing students are pretty able to access these substances. So there are many things that we can do to be protective in our communities and share that information.
That's good information. And I think that those who maybe they don't have children in their homes, but regularly, but they have visiting children, sometimes we don't think about securing our medications also, but that's really important.
Absolutely.
I want to thank Angela and the team from ETSU for their presentation today, and my UT Extension colleagues who are helping to produce this behind the scenes. Thanks for joining us today, everyone, and we really do hope that you'll attend the next webinar in this series on March 24th. It will be a guide to addressing substance misuse in your community, and it will tie together the previous two webinars to talk about what things can be done where you live. You can register on our website, prompt.tennessee.edu, and that is also where you'll find session recordings and resources. Thanks, everyone. We'll see you next time.